Well, one of the most important functions from the Frederick County Health Department, with our mission being to prevent, promote, and protect, one of the critical actions that we're taking right now is the surveillance, which is staying on top of what is going on not only in the world, but specifically in the United States, in Maryland, in our local community. Because with a situation like the novel coronavirus, the risk of exposure has everything to do with knowing who's at risk and knowing how the outbreak might be spreading. From the health department, we have multiple types of plans for different infectious diseases. And so initially our role is the surveillance, and then also another key role early on is always the planning and the helping all of the partners out there to be prepared and to know what's going on, and to have them dust off their plans and think about what can they do to continue their business and their operations and continue to serve their customers. From the health department, depending upon what the infectious agent is, then it might be appropriate to set up clinics for or points of distribution for medicines or vaccines. But right now with the novel coronavirus, we don't have treatments that are specifically available for that, and there is no vaccine that is currently available for the novel coronavirus. The measures that we should be taking every day, even when it's not cold and flu season, and I have to add that influenza is still widespread in our community as it is in the country. So the everyday measures, which is if somebody's coughing, sneezing, you want to keep your distance from them as much as possible. So for sure 3 feet, so an arm's length, ideally 6 feet from them. And that's to prevent against breathing in respiratory droplets. Be aware of what have you touched. If you touch the contaminated surface and then you touch your mouth, your nose, your eyes, well, then you're potentially giving an entry point to the infection into your body. Wash your hands, ideally with soap and water. That's actually best. I know a lot of people are focused on, well, I can't get the hand sanitizer that's 60% alcohol and are stressing over that, but really soap and water is best. If you have a fever, if you have a cough, if you are ill, please try to stay away from others, and try to also be mindful of how many surfaces you might be touching or that you might be coughing onto, and try to limit those.